Welcome to Learning from Success, improving outcomes with new PrEP options. This continuing medical education series highlights HIV prevention at the Owen Clinic in San Diego, California. The Owen Clinic is the largest, most comprehensive primary care center in San Diego for individuals living with and at risk for HIV. They provide inclusive, whole-person care from professionals who respect the beliefs, preferences, and values of their patients.
Hi, I'm Jill Blumenthal. Welcome to Learning from Success, improving outcomes with new PrEP options. It's estimated that only 1 in 4 persons at risk for HIV are on PrEP. In this episode, we'll talk about different approaches to PrEP engagement at the Owen Clinic in San Diego. Joining me today are Christian Turner, Alan File, and Montse Anguino. So I thought we would start talking today a little bit about how people find out about PrEP and end up at the Owen Clinic. I don't know if Alan, you wanted to start?
So two main sources of referrals for us, right? So one, internal referrals through primary care physicians, through the emergency department, and through patients that already come to Owen Clinic that either have friends or partners that need to come here for PrEP. Second would be our external referrals, which would be our collaborations with the San Diego LGBT Center, the San Diego County, the Public Health Department.
We're seeing a lot of patients come to us who may be established for primary care or maybe aren't happy with their primary care. I know that you're dealing a lot with that, Christian.
Yeah, I mean, Owen Clinic is kind of a central repository of like HIV and PrEP knowledge, but there's a big need for PrEP outside of the clinic, especially people that can't get right here in the central San Diego area. So we want to make sure that all of our other providers are supported in providing PrEP to their patients. And some providers just aren't very familiar with it. So that's how a lot of patients end up using our services, is because they know we have the history, we have the understanding of both the medications and the questions that need to be asked when people are going on these medications.
Right. Well, that's a good segue into sort of what the normal process for a new patient who wants to start PrEP, and we'll say oral PrEP.
The PrEP coordinator helps patients navigate access to care at the Owen Clinic. This patient shares his experience.
I used to do all my testing at the county clinic, and I expressed interest in getting on PrEP, and they had a PrEP coordinator available there. And eventually, the PrEP coordinator got me into their kind of PrEP program with UCSD. There was one coordinator who kind of helped me get onto the limited insurance program for PrEP. So I was talking to him a lot too.
As a PrEP coordinator, I try to be the point of contact for the patient if anything is needed. So I usually tell them, if you have any issues, any questions, if you have any issues with your insurance, if you have any questions regarding coverage, if you have any problems mailing getting your prescriptions, or if you can't make your appointment. I have patients that sometimes they're texting me saying, I'm running 5 minutes behind, or I'm not going to make my appointment tomorrow, can we reschedule? So it's just try to make that personal connection with the patient, that one, they feel like they have the ability to and comfortable to just talk about anything, and two, that they feel supported with our system.
So do you want to take us through sort of what that looks like for a patient? Someone calls in or finds the phone number?
If somebody calls the call center, sometimes I get calls from or emails from family health centers or the LGBT center. They'll say, I have a patient here that is interested in PrEP, can you reach out? So the idea is everything starts with the PrEP navigator. And at that moment is when I usually contact the patient. One of the questions I usually ask is, where are you at in the process of why do you want to be on PrEP? Are you on PrEP already? Have you been on PrEP before? How long have you been on PrEP? Have you been off PrEP? Do you have any symptoms? Are you having any symptoms right now? What triggered you to call today? Are you just switching providers? Are you restarting PrEP? Did you have an exposure? Because then we can assess where the need is, right?
I think that's a critical component of a successful program, is having people that can respond to the individual needs of each PrEP patient, because people are going to come here from different places for different reasons, and having that slightly centralized so it can be addressed before the appointment happens. The other thing that I think is really important is grabbing hold of PrEP patients when they show up.
Right.
Because, for some people it's on a whim, it's when they're in the right mood, when they've had an exposure, catching them at that moment when they're actually expressing an interest in PrEP and making it easy for them to follow through on that is really essential to getting people on PrEP effectively.
And so go ahead.
Sorry. I think one of the main facts that I've noticed is you have to make that first appointment a good appointment for the patient to want to continue with PrEP.
Yeah.
Because sometimes by the time they come, they're still undecided. Do I really want this? Am I going to follow through? But if you make a good experience for them, they tend to come back. If they feel comfortable, they will come back.
Right.
Listening to patient needs is a priority at the Owen Clinic. One patient shares his first visit experience.
My experiences with the doctors and the nurses there, all of them are pretty homey almost. Like they're very talkative, very friendly, and not a lot of shaming like there can be with maybe like a PCP or something.
So I think one of our top priorities here at Owen Clinic is establishing that patient care relationship with each one of them. They all come from different backgrounds. We try to treat each patient as its own individual. A lot of these patients refer and they had a bad experience somewhere else. So when they come here, we try to take that burden or that shame off that they tend to have at a regular doctor's appointment.
And that kind of gives them a little bit of room to just be comfortable and know that they can really share any concerns that, being about their sexuality, their gender, or, substance abuse, whatever it is. We want them to be comfortable to share that information for us so that we can fully understand their needs and see if we have all the tools to help them.
But let's go back to this intake. So you talk to the patient, you get all the information that you need. What happens next?
What happens next? I think that the question is always, one of the first questions is, do you have coverage? Can we get you? Can we see you? And if we can't, what are the options? How can we get you into care? I think when we started developing this program, a key point was easy access is what we wanted to do, right? Make sure people that there was no barriers to access to care. That being, they don't have to call a call center. We created a PrEP line that people can call and text. That goes directly to, I have a work cell phone, so there's immediate contact. Before is a call center, messages. So I think one of the primary points was easy access, because we look at the population we're serving. They're young. A lot of the PrEP patients, they're young. They're not used to the health system. They're not used to insurance. They're not used to any of that. So we want to make it easy and accessible. Talk to me, text me, call me, whatever works. So we're trying to test all these different avenues that work for this demographic. So once we know that the patient either has insurance, we kind of look at the possibilities. If the patient doesn't have insurance, then we'll look at signing them up for PrEP app.
Can you talk more about that? Because you're talking about the PrEP assistance program.
Kind of three components of the PrEP, the PrEP assistance program. One, for patients that are completely uninsured. And so if they have no insurance, then they can get their PrEP services covered to that. The second one, which I also offer any patients that have private insurance, PPO plans, sometimes high deductible PPO plans.
HMO.
Or an HMO, but
right.
If they have any kind of car insurance related to PrEP, so the question for me is always, okay, you have primary insurance, let me see if you qualify for this program. Because if you have any associated cost, being labs or doctor visits, that program will pick up as secondary. So we always address that on the first phone call is, let's see if you qualify. Here are the income guidelines to see if you qualify. The last part of the program is the confidentiality bucket, which means patients that are insured through either their parents or their partners, and they don't want to use that insurance. They have the ability to completely bypass that insurance and use the patient's assistance program as their primary insurance. So we do have a lot of patients when you're looking at the young kids that don't want to be using their primary, their parents' insurance. it's definitely a great avenue to get people into care, because that is a barrier sometimes that people call, or people that are in the military, they don't want to use their insurance. There's so many
different
reasons for them not
And this
to.
is one of the things that you're so good at, is getting creative and listening to what the patient is telling you about what has and what hasn't worked for them in the past, what they're worried about.
Right.
A lot of our PrEP patients that come to us, they've sought out PrEP before, maybe through their primary care physician or maybe just an outside provider, and they've come into these barriers, high deductible, copays, access to labs. Maybe their labs cost a lot, and having somebody that's, one, creative, and two, very knowledgeable about what the options are really helps in getting people to overcome those barriers to access that they might have experienced before.
Yeah, and I think you just brought up, barriers to care, which I think is one of the things that we sort of say we're not going to let that happen. We try to break down as many of those as possible. Even though no one wants to talk about COVID or the pandemic, what I think it really did was open up the possibility for telemedicine, and I think we've really taken advantage of that here in our program at Owen, but also for primary care. Christian, you're doing this a lot now with patients. Can you talk about some of the ways that you've been able to do this and how this has broken down even more barriers?
Yeah, I think one of the things that is a real benefit to both patient and provider is, there are rules when it comes to PrEP. Things that you're supposed to do to prescribe it in terms of monitoring and evaluations. And with oral PrEP, theoretically, you're supposed to see or talk to this patient every 3 months and get an HIV test and get labs done. And if somebody has an office copay, they're going to have to pay that 4 times a year, and that can be extreme for somebody that maybe doesn't have a lot of sexual activity or risk for exposure in their life. One of the things that we've been able to do by really focusing attention on telehealth is making it easier for the patient, because we do not charge for that visit of telehealth. It's a lot more convenient in terms of hours of operation. So we can work around lunch hours, after hours, those types of things, because a clinic is very expensive to maintain. So being able to offer expanded access to our patients has really been beneficial for them.
Right. I think we're a group of providers who are used to working with patients who've experienced health disparities and things that maybe other providers have either never discussed with them or really shied away from. Or if they have asked about it and a patient's been honest, they've been, made to feel ashamed of that behavior. And I think that's really the last thing that we do. We really want to get as much information about a patient as they're willing to share with us.
This patient, a transgender person who moved from San Francisco to San Diego, offers their perspective about the Owen Clinic.
My doctor and I had an incredible conversation because I felt like, coming from San Francisco in terms of like gender and, sexual health, like I feel like they're very ahead of the curve and non-conventional. So my doctor and I had a really good conversation, and he could tell that I had like ideas and suggestions. So he actually ended up passing me off to a second doctor who was actually friends with the person that referred me to the Owens Clinic in the first place. So that's actually started a really nice connection and gender journey.
One of the other things we're seeing here more and more as we're doing more gender health here, and for this patient, they really had a very good sense of both aspects, both of their sexual health and their gender health. But when it happens that someone is coming perhaps for one thing, they think they're coming to this clinic because they want to talk about, starting hormone therapy. And then when we take a history and we learn that maybe PrEP would be a good option for them, we can talk about that. So we're able to do that sort of all together. And I think we know from data that actually trying to combine HIV treatment along with gender affirming care can be really beneficial for patients. Yeah.
So I feel like we see that a lot, is like you're saying, you'll come for something else, and then once you dig in and start asking questions, people sometimes are not aware that they are at risk.
And I think this is one of the ways that things have been shifting lately, and where they should shift to is, Traditionally it's been PrEP is something that people seek out. And they've been part of a community, maybe there's community pressure, or they've heard about it from somebody that they trust or believe in, and they come seek it out. And what we're trying to do now is reach out with PrEP information to these communities that aren't coming to us.
But what are some of the groups of individuals that you don't feel like we're seeing as much, and what are we hoping to do differently so that they do feel comfortable coming here, or at least to UCSD or another clinic?
Yeah,
Christian, what do you think?
I think one of the things we're trying to do is actually reach out to other providers and making them recognize that this is something that should be asked about in a general visit with their patient, is to do some sort of sexual history to try to analyze that individual's risk. And if they're not comfortable doing that, then let us do that for them. So there are communities that have traditionally been really underserved in getting PrEP, like you said, white, gay, cis male. There's plenty of community pressure and community influence out there that a lot of people know about it. They will seek it out. But when we talk about women, or when we talk about ethnic minorities, immigration, recent transplants, they're not part of this healthcare system that has really focused a lot on PrEP. And the providers haven't been either. So trying to give them access to information or an outlet to kind of offload those patients for care, I think is really critical.
Yeah, and I mean, you made me think of the fact that the CDC guidelines for PrEP, the new ones that came out in 2021, said that PrEP should be discussed with any patient that is sexually active. So I think a lot about, and this is, for me, the group that we still haven't been able to reach as well as I would like to, and there are many, but it's cisgender women is the big group. So we've still had trouble breaking into that group, but the idea now is that anytime a sexual history is taken, and a lot of them see, gynecologists or reproductive specialists for various reasons, the conversation should be about both reproductive health and sexual health, and part of that sexual health discussion should include PrEP. And I think that message is starting to get out more, but I still think we, at least in San Diego and at least in this clinic, have room to go with that group. And so I think what we do is when patients decide to do PrEP, we celebrate that. If, maybe a better word, we're very PrEP positive and we're very sex positive. And I think what we want to do is what will work best for you. And I think that with this, us initially being a clinic that served patients living with HIV, we were used to the every 3 to 6 month follow-up, which we're very accustomed to doing, and it's part of what you do for PrEP.
One part of keeping people engaged in care at the Owen Clinic is scheduling follow-up visits, as this patient explains.
So I normally, with each visit, I already schedule another 3-month visit, or another visit within a 3-month time frame. So it's never really needing to follow up. Usually any follow up that I get after an appointment at the clinic is really just results for my tests.
So usually upon discharge, this is something that me and the doctor already went over their chart. She already discussed what was going to be the plan for this patient. We try to schedule the appointment based on their needs. I'll go back into the room, schedule a 3-month, 4-month, or 6-month follow-up. I'll ask them what day and time works for them, if they want to come into the clinic, if they want to do a televisit or a telephone appointment. By the time they leave, all their questions have been answered. If there is any follow-up that they don't want to get in a printout because of confidentiality, then I'll go ahead and set them up with my chart. And that's an app that they can log in themselves through the phone or any PC. They have access to their medical records. They can schedule, cancel appointments, check their labs, order refills, and that's basically our main point of communication with most of our patients.
I think we always tell patients, even if you don't feel like you need to be seen, maybe you've stopped taking PrEP for, whatever reason, just check in with us. We can move the visit, we can cancel it. We just don't want to lose sight of you entirely. And I think patients are pretty good about that.
I think anybody that's worked in PrEP knows the biggest issue, other than getting access to underserved communities, is retention and getting people to understand that this is maintenance.
Yeah.
And so trying to make that as easy as possible for the patients by scheduling appointments before before they leave by giving them other options in terms of how to keep in contact with us so that they don't disappear, and then the time that they reappear is when they've run out of medication and they've had an exposure. So the goal with PrEP is to keep people maintained as long as they feel they need to be, and giving them easy options of how to reach us.
Just the last thing that I wanted to say, we've talked a lot about PrEP, but I think what we've also seen PrEP do is for people, and the patient that we were talking about was a new person to PrEP and was new to the health system. It also brought them in to talk about some primary care issues. And I think some patients, the insurance won't work for it, but sometimes, and a lot of times it does. So we end up doing more for patients, and so many patients ask to actually move their primary care here, particularly if they were referred from outside of UCSD. So I also think that's sort of the other part of the engagement in our PrEP program. It ends up being sometimes more than that. But I think this was great. I think we had such a great conversation about how we engage patients, what we do well, what maybe we still want to do better, and what we're hoping will happen in the future.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with this episode. Your certificate will be available to print upon successful completion of the brief post-test and evaluation.